Welcome to the next episode of 6 Degrees of Jigsaw, where we connect the dots between people we know well, ideas we share, and innovation that we inspire. Today I am honored to be joined by Dr. Eric Pifel, fellowship-trained orthopedic surgeon, part-time marketing executive, all-around great human and friend. Dr. Pifel, thank you very much for joining us today.
Thanks for having me, David.
So today, I'm going to ask Dr. Pifel to put on his marketing hat as it traded in for his surgical cap and talk a little bit about how marketing is currently shaping the orthopedic landscape. Let's roll right into it. From your perspective, is orthopedics a very competitive category in our marketplace right now?
Well, David, I think orthopedics is a very competitive market anywhere. And when it comes to marketing orthopedics, just like the majority of medicine, especially when you talk about boutique medicine like orthopedics, plastic surgery, urology, big money medicine, marketing is key. And Milwaukee is a very, very competitive market with multiple players. So when it comes to marketing, it's very important for the companies that we work with and around the city to make sure that they know how to get to consumers and get those consumers in their doors in order to build their business.
With marketing in that competitive landscape, what is your insight in terms of how important is the brand message as well as the services and how services are provided that really help to resonate within that category and really differentiate you in this very competitive set?
So brand name, brand recognition are very important through any market. And when it comes to medicine, especially, people are putting trust in a provider. So when you build brand recognition, it creates a semblance of trust for those people to become clients and patients for the companies that are using this marketing. When it comes to building interactions and relationships with people, you have to have brand recognition. So you have to get your name out and you have to tell people what you actually can do for them. And some of that is difficult because when it comes to medicine, there's a lot of technicalities, there's a lot of nuances. So it's really creating a single voice so people can understand what that practice can do, create brand recognition to create trust, and to do enough marketing to bring them in.
As a follow-up to that, you spoke very well about the brand side of it. What about the delivery of services? Do you think that that is also a primary differentiator for orthopedic practices?
Absolutely. The delivery of information comes in many ways to our consumers, either in brand recognition from signage, from having things on the internet. There is also the ability to translate what these consumers need when they come to our practices. But there's many ways to figure out how to do that marketing in a community. You can do it from a high level, super expensive TV ads, super expensive billboards, down to building things up from a grassroots level by doing sponsorships with kids and nonprofit organizations, and then building that community trust through all these facets that are either very inexpensive but time intense or very expensive and not very time intense. And it's creating a brand that uses all these tools in order to build that consumer trust.
Excellent. And you touched on it a little bit, and maybe we can elaborate it in terms of the importance of those sponsorships and partnerships. Do you see those being a great leveraging point for those that are in the orthopedic category?
Yes, I mean, orthopedics is about active lifestyle. It's very easy to find grassroots organizations, nonprofit organizations that need help, but also it allows us to give back to the community. It allows us to create name recognition and clout and create trust by being involved, creating services, and always being available when people have an injury.
From an agency perspective at Jigsaw, When we do marketing communications, one of our objectives is always to take a look at, the results from what we're doing, from whether it's a paid social media, whether it is sponsorships, partnerships, promotions, things of that nature. Wearing your marketing executive hat, in your experiences, have you witnessed these types of platforms, these types of things in the marketplace that help to drive results or bring people to orthopedic practices?
Absolutely. Jigsaw has been instrumental in working with the companies that we have, and when it comes to building our brand, you come with a huge set of tools. We in Orthopedics have a set of toolbox, or a toolbox with a set of tools that allows us to take care of patients. Tools in the OR, but also medical tools that allow us to deal with problems. You have a toolbox that has given us many options on how to create our brand. So we've seen the utilization of search engine optimization and getting brand recognition because of a constant ad campaign, working in the community altruistically. But Jigsaw has allowed us those tools in order to help us build our brand recognition, and we see that constantly throughout the community. We see our competitors using it, and we try to make sure that our tools are better than theirs.
Orthopedics, the category, yourself included, oftentimes has heavy involvement of, the orthopedic doctors themselves. Is marketing in the category, again, from your perspective, something that is hard for them to adopt? And if it is, because clearly, and we appreciate you sharing, you are an advocate of the marketing that we're doing, but if they are apprehensive about it, what would you tell them? What would you want them to know? Not to give a competitive advantage, of course, but from just taking a look at marketing and the importance of marketing when they're a little bit more reluctant to do so.
Well, what I would say is a lot of that reluctance comes from older school understanding of ethics. Even me, who was in his early 50s, during medical school, we had ethics classes that talked about the ethics of marketing. This is in the 1990s, and even then they were saying marketing yourself is not appropriate. You're a professional, the people will come to you if they need you, you don't need to go out and market yourself. Well, that has been pushed away by almost every medical facility throughout the United States, and reasonably so. If you market yourself ethically, tell people what they can have, tell them what they might need and what resources you have, it's important. This day and age of instantaneous information, if you don't have some type of marketing, you are not going to have clientele. I am getting older, and as we see physicians starting to push into becoming influencers and these social media gurus, they're bringing in younger populations because they're utilizing these tools. I would say to a physician that has reluctance about marketing, if you do that, you better have a company that is going to get you clientele, because if you do not, you are going to lose out to all your competitors because everyone's using it now.
Well, those are all of the questions that I had for you today. Again, we really appreciate your time, appreciate your insights, and that'll wrap up this episode of 6 Degrees of Jigsaw with Dr. Eric Pifel.